So, good afternoon, everyone, and welcome to episode 16 of the live series of Mind and Body Wellness Health Talks. And this particular episode, we're going to focus on the fascinating world of homeopathy. So, it's a natural, holistic approach to health that has been around 200 years or so, I'm told by Jerry, at least that, perhaps even longer. And Jerry is our lovely guest speaker today, Jerry Norris, or Geraldine Norris in full. And she is a professional and licensed homeopath with how many? 8 years of experience. Maybe more, I don't know. She's also a valued volunteer of Thriving Communities and helps us out with the Mind and Body Wellness Program. So who better than to support us with these series of live health talks? And so she'll just run us through what homeopathy means, what it's all about, and how it can support our health in various different stages of our life. So over to you. Thank you, Jerry.
Hi, Esther. Hi, everyone. Thank you for joining us today. It's a pleasure to be here. So, as Esther said, if there are any questions as I go through, it's not really a PowerPoint. It's more little prompts for me, really, with some information on there. And so, pop them in the chat, and I will perhaps ask as we go along. It depends how the time is, really. I'll see how we go for time, isn't it? So I'll just share my screen a second. And hopefully you can all see that. Yeah, good, good. So as Esther said, I'm a licensed homeopath and I'm also a yoga teacher and volunteer with Mind Body Wellness. And I'm here today just to share a little bit about homeopathy because most people don't really know what it is, isn't it? It's a little bit mystical. So oops, just trying to go to my next slide and it doesn't seem to be working. Hold on a sec, sorry.
The return key may do it as well. I don't know, try that.
Okay, so what to expect from today's talk? I'm going to introduce you to what homeopathy is, insights into homeopathy's history and principles, explaining how homeopathy is a holistic therapeutic complementary treatment. We'll explore what homeopathy treats and what to expect from a homeopathic consultation. And I've included a few testimonials because it's always good to have some real life situations there for people to share their experience. So what is homeopathy? So homeopathy is a system of medicine which involves treating the individual with highly diluted substances made from plants, minerals, metals, animals, with the aim of triggering the body's natural system of healing. Homeopathy is based on the principle of like treats like, or the law of similars. This concept is often used in conventional medicine. So, for example, peanut allergy sufferers may be given small amounts of peanut to reduce or cure their sensitivity to peanuts. Some people claim that if they take local honey made from the pollen of their local area, it helps to reduce the sensitivity to hay fever, perhaps, or pollen-related respiratory issues. And my sister actually gave me a jar of natural wildflower bee pollen. And I thought that was quite a good example, really, to share with you. It's from Pengham. It's produced in Pengham. And she claims that by sprinkling this on her porridge and on her cereal, it's helped to reduce her sensitivity to hay fever. So similar concept then. So homeopathy was developed in the late 18th century by a medical doctor, Dr. Samuel Hahnemann. He was also a medical translator who read that Peruvian tree bark cured malaria. And this prompted him to take a dose of this Peruvian bark, and he immediately developed symptoms of malaria. He repeated the experiment on himself and healthy volunteers, and he realized that it could have curative properties. He continued to experiment and refine the process where he wasn't just using the raw material, he was diluting it and diluting it more and more. And he would shake it as well. So in herbalism, they actually take the whole plant, so the roots, the leaves and everything, and then pop it in alcohol, and you would actually take that substance then. But in homeopathy, they actually continue to dilute it, and they shake it rather like a cocktail waiter would. And it's called succussing when they shake it. And they also thump it on a large book or a Bible, or maybe on a harder surface. And this is said to increase the intensity or the energy of the substance. So from those initial experiments, 6 years later, Dr. Hahnemann published his findings that each substance tested would produce in a healthy individual symptoms similar to what it could treat, validating the principle. By similar things a disease is produced, and through the application of the like is cured. So the ancient Greek physician Hippocrates actually stated that many years before Hahnemann's discovery. So homeopathy was born 200 years ago, or over 200 years ago now. In homeopathy, it's a holistic approach. It's not just one remedy to match certain symptoms. So, for instance, if you had a headache, you take a paracetamol or a painkiller. It's not as simple as that. The treatment is tailored to the individual as a whole, taking all aspects of their health and well-being, not just their current symptoms, including past medical history, lifestyle, with the aim of stimulating their own unique life force and body's natural healing ability. So the remedy isn't actually treating the symptoms as such, it's treating the individual, helping to kickstart, if you like, or just to remind your natural healing ability what it needs to do to help to clear those symptoms, so or maybe even cure them. Dr. Hahnemann was way ahead of his time, and he also identified that in individuals, there's a certain susceptibility to certain types of dis-ease, and this became apparent from taking family histories as part of the case taking. He termed this susceptibility as a miasm or taint, and today we understand this as a genetic predisposition for certain illnesses or diseases or certain conditions. So, as I said, he was really way ahead of his time when you think about when this was then in the late 18th century. So why choose homeopathy? Homeopathy is a safe, effective, individualized treatment. It can be used in treating acute and chronic symptoms, both physical and mentally and emotionally. Homeopathy is safe and effectively used in pregnancy, birthing, perimenopause, menopause, plus many other health conditions. According to the Homeopathy Research Institute, globally, over 200 million people use homeopathy on a regular basis. The largest user of homeopathy in the world is India, with 1.2 billion people use homeopathy on a regular basis. That's 83% of the Indian population. And these stats are sourced from the Homeopathic Research Institute, and they were set up by a homeopath and a physicist as well. And they have been exploring and investing in funding to be able to carry out top quality research there. And homeopathy is often used to treat animals and in agriculture with documented success. In fact, at King Charles's Highgrove estate, he's a big fan of homeopathy, as is many of the royal family. He runs courses, or did when he was the Prince of Wales, homeopathy at a welly level. So you'd go along and sign up for the course, and it would be learning to use homeopathy to treat your animals and your plants. Well, on your farms, I know several farmers who use it, and also successfully on their plants as well, and on their crops. So what to expect from a homeopathic consultation? Well, initially, I recommend that people contact me and arrange an initial free, no obligation, confidential discovery call. We can discuss then what homeopathy would mean for them, and they can express any concerns. And sometimes maybe homeopathy isn't for them. So that's quite useful, really, rather than pay for a first consultation. If they decide that they would like to book an appointment with me, then a first consultation, I recommend that they complete a confidential health test. Oh, sorry about the dog. That's what I was worried about, the dog barking. So apologies. There we are. They've popped the dog outside, I think. So initially, completion of a confidential health questionnaire. Earlier on, I mentioned that it's quite important that we don't just focus on the physical symptoms that perhaps they're coming to homeopathy with, but we take case history and family history as well, and take into consideration their lifestyle. And we quite like the strange, rare and peculiar symptoms. So a strange, rare and peculiar symptom can really help the homeopath pinpoint a certain remedy. So an interesting fact. So for instance, I saw Miriam Margolyes eating an onion like an apple, and she said that she does that every day. Now, to me, that would be quite a strange, rare and peculiar symptom, because not many people eat an onion a day rather than an apple a day, isn't it? So again, that would help perhaps guide the homeopath to select the remedy. In fact, there is a remedy called allium sepia, that is actually made from an onion, allium sepia. So the initial consultation would be 60 to 90 minutes long. So it seems quite a long time, but it's quite nice in a way, because some people comment that for the first time in their life, they're actually feeling heard, and they're able to speak their truth. And it's surprising what comes up in a consultation. Then the homeopath prescribes a personalized prescription, and then a follow-up consultation is made for maybe 4 to 6 weeks time. And that follow-up consultation would be about 60 minutes. I made a mistake on my slide there. It would be up to 60 minutes, not 90 minutes for that second consultation. At which point, maybe another remedy would be prescribed, maybe more of the initial remedy, or perhaps in rare cases, they might be better. But if it was that successful, then I think I would be a very wealthy woman. So one pill and a cure would be wonderful, wouldn't it? But usually it takes a little bit of time. So and it might take a number of remedies to be able to get to that stage. So I've included some testimonials. So this one person has shared, so my stomach is still doing great. I've not had any upset since taking the remedies, and the cough seems to have disappeared. The homeopathic treatment was very simple and effective and resulted in me not having cold sores for a few years, which is amazing. Jerry's consultation was personal and tailored, taking into account my symptoms, my psychological state, any worries and lifestyle, to prescribe an appropriate remedy, helping my overall well-being and gradual return to a healthy state, enabling me to cope with my situation. I will always be grateful. And I'll leave that on now, and I'll take any questions if there are any. I'm sorry about the dog barking.
All
As
right.
I said, I was
Apart from the onion, was there any other strange symptom or
yeah. So
funny condition you've treated?
Yeah. So for instance, maybe some people can relate to this, isn't it? So one one case then is where this was years and years ago. So this was when I was training now. So the little toddler, there was a coal bunker outside the house, and they had coal fires. And the little toddler used to lick the coal, used to get pieces of coal and actually lick it. And she'd have a very black mouth then. But again, there might have been something lacking, and she was naturally drawn to that substance because it had curative properties for her. Who knows, isn't it? So that's a pretty strange symptom, because not many toddlers lick coal either, do they? Are there any other questions?
What's the most common or perimenopause symptom you've treated? So what seems to
the most common, you say, is it?
Yeah, most common, yeah.
Yeah, I think probably the is that fluctuating hormonal stage. So flooding, so menstrual flooding, and just the unpredictability of it, that you never know when they're going to come, and they can come at pretty inconvenient times then, isn't it? So but it is part of the nature of perimenopause, because that's exactly, what happens then. The hormones are in a state of flux, but it can help to just restore balance there, and just help to ease that. Vaginal dryness is another thing that can be treated. But as I said, it's not specifically the symptoms. It's just usually people, when you prescribe, they say, "Oh, I felt better than I felt for years." So it's as if it's. I know that you deal with energy, Esther, isn't it? And it really is. It's the energy of it, because some people just come to the consultation, and without me even prescribing the remedy, which I sometimes do on the spot, or sometimes I might not have that remedy with me in clinic, so I need to post it to them, or even order it in if it's quite a one that's not so common, and they'll say that they started to feel an improvement without actually taking the remedy. It's as if I don't know, it's just that energetic resonance then, isn't it, of it? So it's quite interesting.
Esther, can I ask her a question?
Yeah, go ahead. Yes, please. Thank you.
Thank you, Esther, obviously, for the organizing, and thank you, Jerry, for your wonderful talk. I am a big fan of homeopathy, though I'm a medical doctor, but since my childhood, I've been having this arnica for the pain, and I've used for my sinusitis and pee regulation, and touch wood, from India. So, question is that, is it a myth or is it true that I was told not to have a onion, garlic, and coffee when you're having a homeopathy medication? And second question is, can we take allopathy medication along with homeopathy medication?
Oh, thank you, Sangeeta. So, yes, there are certain substances that can antidote homeopathic remedies. So, eucalyptus, coffee, as you said, really strong, spices, perhaps. They say that it's better to avoid taking them at the same time as the remedy. Remedies are not actually, usually they're prescribed in pilule form, but not necessarily. So, for instance, you could have a liquid potency, which is quite useful for babies or children, and you can just give them a few drops. Or perhaps post surgery, you might give someone a liquid potency so that they can take it a little bit more frequently then. But when you take it, it is best to avoid taking it at least sort of 30 minutes after a coffee or cleaning your teeth, because again, peppermint again is a strong flavor, and it can, so they say again, because we take all our guidance from Dr. Hahnemann, and they might not have had toothpaste in those days, but yeah, they did have coffee. So yeah, he through his experiments he did discover that certain things can antidote it. But some homeopaths, classical homeopaths, they recommend that you avoid coffee altogether during homeopathic treatment, but that's not always the case. I think more modern day homeopaths now say within 30 minutes, because we've become a nation of coffee drinkers, haven't we? So Costa's, Starbucks everywhere, isn't it? Cafe Nero and everything. And I hope that answers your question, Sangeeta. And then I'll answer your second question in a moment then. Yeah. So Sangeeta's second question was, are you able to use homeopathy along with traditional, conventional prescribed medication? Or so technically, yes, but it depends what the medication is. So you mentioned there that you're a big fan of arnica. So the arnica,
Yeah.
most people, if you ask them to name a homeopathic remedy, they will say arnica for bumps and bruises and things like that. But arnica, we need to prescribe with caution there, especially if the client or the patient is on blood thinners. So that would be one indication of that. But there are other medication as well that we would need to look at quite closely, really, to make sure that we're prescribing to restore balance and harmony to the individual. We don't want to cause any harm at all. So it would need to be looked at quite carefully. And that's one of the reasons with that health questionnaire initially, as I said, we asked for it to be completed, that on there's a section, are you on any medication, on any prescribed medication? And each homeopath, me included, we have a copy of the BNF, so a pharmaceutical guide to all the medications. And of course, we can look at the side effects there, because sometimes some of the symptoms that people come to clinic with are actually side effects from perhaps the drugs or the prescribed medication that they're on. So it's a very fine line. And this is why I mentioned earlier on that sometimes homeopathy isn't going to be able to help as such, because if they need to take that medication and there is an aggravation there or side effects, then that would need to be looked at really with your medical profession. It's not, homeopathy, there's only a limit to what it can actually do. So I hope that helps, Sangeeta.
Yeah, thank you. And while you mentioned arnica, obviously, can we use arnica tablet as well as the ointment for the pain?
Yes,
Sorry, and when you go to I think Boots, or I'm not sure, other store where they sell homeopathy medication, is it the higher number is the lower potency, like 6C arnica or 30C arnica, something like that?
yes, that's right. I haven't really discussed potency because I was only giving a brief introduction.
Sorry.
And no, it's fine. It's such a huge subject. But yeah,
Yeah.
no, it's a valid question. And it's great that you've asked that question. So you can take the actual pill and the apply the cream as well. But arnica mustn't be applied to broken skin.
Yeah.
So that's something else. But again, on the when you buy the ointment, so you can they even sell it in Home Bargains now,
Oh,
arnica
right.
ointment. But you mentioned, Sangeeta, potency. So I noticed that I had a little look at the cream, the ointment that was for sale in Home Bargains, but it's not always as pure as perhaps the pharmaceutical grade ointments, because they would use more of the pure substance. And I was just looking at the tea tree oil, incidentally. It's not homeopathy as such, but I was just looking, and they had bottles of tea tree oil in Home Bargains, which was £1.99 compared to maybe £8 you'd pay elsewhere. But then you look at the small print, and there was only 20% actual tea tree oil, and then the rest of it was an artificial substance. Then, so a oil produced. Mass produced, then it wasn't actually tea tree oil, so as such, so obviously it would be less effective then. So I have an interesting story there, because it's quite I'm a big fan of stories, because you'll remember those things more, and because I always do. And I remember years ago when I'd recently qualified as a homeopath, I was invited to a local NCT group, so National Childbirth Trust, to do a talk on homeopathy. And one of the little toddlers actually walked into the corner of a table, and then this big egg came up on their head, then this big bump on their head. And I said to the mum, I said, oh, well, would you like to, I had the cream with me, I had my little homeopathic kits with me. And she said, oh, I'll try it. So she gave the little toddler quite a low dose of arnica, and the bump just just went down. It was amazing. So I'd been speaking for half an hour, and then that incident. So suddenly I was the most popular person in the room then, and everyone wanted to know about homeopathy. So quite interesting.
Oh, thank you. So for the potency of the pills, 6cc is stronger than 30C?
Oh, sorry. Yeah, you said about the potency. So with
Yeah.
homeopathy, the 6C is lower, is not as strong. So the higher you go up through, like you said, so arnica 6C means that it's been diluted. It's been diluted 6 times, really. They dilute. I mentioned earlier on. Sorry, mentioned earlier on that you take the whole plant. Then, so arnica is a flowering plant that grows on the ski slopes of Europe, and you would take that plant and you would grind it down, and you'd add alcohol to it, and then that gives you your mother tincture, as we call it. But then that would be diluted. 1 drop of that would be diluted, shaken, banged, and that then would be each time you do that would be, so 6 times that would be your 6C potency. So you would dilute it even more then. So common potency is 30 perhaps. So in homeopathic pharmaceutical establishments, you can buy remedy kits. So for instance, I've brought some along just to show you. So this one is a homeopathic remedy kit. Oh, sorry, can't see it there. There we go, that's better. This is Helios, is the pharmaceutical company, and they produce these remedies for travelers. And in this kit, all the remedies are 30C. So they've been diluted 30 times. A drop, add more to it. And so some of the potencies are diluted 100 times, and then some are diluted 10 times. So it depends how it's a little bit complicated. I don't really want to get into it too much, but the higher up you go is usually the more potent they are. So 6C is a very low dose.
And 30C is stronger than 6C.
They're 30C and then 200. So another instance would be, I've got another kit here. Let me see if I can change my background, because I think that's what's there we are. That's better. Okay. So with this one, this is a homeopathic remedy kit for childbirth. So for instance, and again, this is from Helios Pharmacy. So Helios Pharmacy are based in Kent and Covent Garden, but all the remedies in here are 200C potency. So they're much, much stronger, because if you've ever given birth or you've attended someone who's given birth, it's quite a high energy, isn't it? So usually you would need to prescribe quite a high dose for the remedy to match the life force or the symptoms that are going on at that stage. The lower potency, as Sangeeta said, so for instance, the 6C, often those potencies, 3C as well, are used quite successfully when treating people with low immunity. So perhaps in when they're receiving cancer treatment with oncology patients, then cancer patients. So you could use those lower potencies, which are much gentler in supporting that person's life force, that their energy, natural energy.
Thank you.
Are there any other questions?
I guess the beauty of homeopathy is they're sweet medication or a pill. So it's so easy to sort of, you don't have to swallow or anything. Just put it on the tongue and done. And
that's right. Yeah. So you wouldn't just take the remedy and swallow it like we would a pill. And you can just pop it, little sugar pills.
Yeah. So. And is it that we're not supposed to drink any water for, let's say, 10 or 30 minutes after taking the pill?
Some homeopaths, again, classical homeopaths, they are quite regimented about it. But again, if you're using it with animals or children, then it's still been proven to work, really, and they're not following that protocol. So it's quite interesting. Yeah. And also, we're talking about arnica for bumps and bruises, but the homeopathic remedies are made from different things as well. So, for instance, we talked about arnica there, but some specific types of homeopathic remedies, for instance, we have something called nosodes. So homeopathic nosodes, the remedies, are actually made from diseased tissue. So an example of this would be, so you've all heard of superbugs then, isn't it? You're thinking about antibiotic resistance. That would be something that we've all heard about. And I'm not here today to talk about, antibiotics and things like that, but homeopathy can help in the treatment, for instance, of MRSA, Clostridium difficile, or C. diff as it's known. In fact, there was a Radio 4 program recently that introduced the concept of a stool bank. So for the treatment of the latter conditions, as it had become quite problematic in hospitals. So people were going into hospital and they were picking up these MRSA infections, or C. diff, or CDI as it's abbreviated as. And they had realized that if they actually took little, again, sort of samples of this, of the stools from people who had that disease, and then they could make that into medication and then administer it, and then it would bring a certain resistance to it, or a certain curative factor to that. So again, Dr. Hahnemann, way ahead of his time, all those years ago, 200 plus years ago, he identified that as something that could be used. But as we use diseased tissue, we can also use homeopathic remedies from healthy tissue, and they are called sarcodes. So an example of that would be perhaps remedies made from tongue or hair follicle or taste buds. And these, again, are used quite successfully in cancer patients where they've received radiotherapy, and they are able to, on chemotherapy where they're perhaps losing some hair, you could use these sarcodes to actually reduce the impact of that treatment, so that the hair would grow back quite quickly, or it would limit the amount of damage perhaps that treatment would cause as a result of that. Any other questions?
Anybody else?
I hope I haven't waffled on too much. The thing is, I was thinking, just use your slides, Jerry, so that you don't go off ramble.
But it's fine. You don't know what questions come up anyway, do you? So
yeah.
Yeah. And thank you, Sangeeta, for asking them as well. Yeah. I definitely got a better understanding now of homeopathy, and hopefully some of the other people that have joined the call will also have a great, clearer insight. Yeah.
That's great.
Yeah, that's it, isn't it? It's a part of what you're here to do, isn't it? Just raise awareness, and
of course,
people feel it's right for them, then they can reach out to you and get that free consultation or initial dialogue, as it were, just to see what's possible. And just really fascinating, really. I think that it's a bit like, I suppose we have these they're sort of like against the virus, you have the bit of the virus in you. It's a similar sort of principle, isn't it? But it's all more natural in a way. It's not.
That's it. We call it prophylaxis, where, like you said, in a vaccine situation, they would give you that to build up your resistance to it. In fact, one of the largest probably trials that ever took place was in Cuba in 2007, 2008. Health officials conducted the largest prophylaxis intervention when they'd had extensive hurricane damage, and they were trying to figure out how they were going to prevent the population with the rising rates of leptospirosis. So it was causing problems there. So they decided to try homeopathy because they didn't really have the time to do mass vaccination. So they just used homeopathy, and they popped it in water and just traveled around and gave people that remedy. And it was very, very successful. And it was concluded that homeopathy could be used to immunize people against targeted infectious disease such as leptospirosis. So, and that was about 11 million people were treated with that very successfully, and they've continued to use it since.
You know, you mentioned that Hahnemann did that sort of experiment with malaria, because malaria is still a thing, isn't it, in certain
Yes,
continents?
it
And it's
is.
like, are they introducing homeopathy for that at the moment?
They are in certain countries. It's part of the health service in Mexico and Switzerland. It was much more prevalent in the UK. We had 5 homeopathic hospitals at one point in the UK, and in America they had many. But it's just been downgraded, really, I think. So I don't think they're using it as much as they did, apart from in India. In India, I would say 80% of the population, that is their only source of medical intervention, and it's used very successfully. And they're leading the way, really, with treatment there.
Interesting. Thank you. So if nobody has any more questions, we'll conclude.
Hello.
Oh,
Hello.
sorry, is there one there? Yeah, could it?
Yes.
Yes, go ahead. Yes.
Can I just ask you, please, there are about 3 people that I know, but it's been I would say a few years. They had some treatment for asthma, headache, and some sort of allergy. And these 3 people at different times, they went to Chinese homeopathy. And they said whatever they had, firstly, it was more came out with the first treatment, which they couldn't see physically, but now physically it's outside the skin. Like if it was asthma, they got it more, but they had to go back again, which the specialist suggested. But because just by one treatment they got more, they never went back.
Yeah.
Because there is a certain treatment again which they needed, but because they got so scared, they never went back again.
Yeah, so I can relate to that. So homeopathy and traditional Chinese medicine, they're quite different, but they all have a holistic approach. So they treat the whole person. But also in homeopathy, we have something that is called the law of cure. So Heron was a doctor in America, and he was quite a skeptic about homeopathy, really. And he set about disproving all the theories, and then he ended up being the biggest advocate for it. So he became a homeopathic doctor. So he actually identified that often when homeopathic treatment is used, there is a law of cure. So perhaps from the inside out. So as you mentioned, those symptoms, the asthma cleared, I think you said, called it, but they then had a skin aggravation to it.
Yes.
So that can sometimes happen, you see. It's as if they're taking the asthma and rather it then clears the lungs, but then it does still need to discharge from us energetically. So it moved to the skin. So then that's why I said that perhaps that initial remedy, once you have your first consultation, you go back and then discuss what has happened. And it might be that another remedy is then prescribed, or more of the same initial remedy, or maybe it would be a case of waiting because perhaps that initial remedy or initial prescription is still active, and perhaps just reassuring the person as well that this is a good sign that's happening. But yeah, I appreciate that some people would be afraid then, isn't it? But then I think if you came to me, I would explain that is a possibility, and it's actually on my letter actually when I send out the prescription, and initially that sometimes symptoms can become quite aggravated, and then there's a clearing then, and other things might come up. It's rather like peeling an onion.
Thank you. Thank you. You've explained it so well now.
Oh,
I understand it. Yeah.
Thank you, Kuldip.
Thank you.
I think that was very useful talk. Thank you, Jerry. And when you were talking about arnica, the first time I tried arnica as an oil when I had a back pain recently, and that arnica actually helped. Yeah.
Oh,
yeah.
That's brilliant.
Yeah.
So some other remedies, a lot of the remedies are made from plants. So for instance, if you were talking about arthritis, for instance, then rustox is a remedy that we use quite a lot of, and it's sort of been nicknamed the rusty gate remedy because it's so if you had joint pain or arthritis that which was better for movement, because in a rusty gate then initially it's sort of a little bit jammed, but then if you can get moving, that helps. So that would be something we'd use there for that.
Is rustox is like an oil, or is it oral liquid?
You can buy it in ointment form. So I sell the ointments as well as the remedies, but obviously I encourage people to come to me first rather than just start prescribing for themselves, isn't it? Because you do have to be careful. But you can buy the ointment, and it can be quite useful for arthritic or stiff joints, then stiffness in the joints then.
Okay, yeah, that's something useful to know. Yeah, haven't heard about that before, but no, I think it's wonderful. I don't know why the homeopathy has gone down. I remember that, when I was doing a GP training, my GP trainer a few years ago in Roth House Surgery, he was a homeopath as well. So he, as a passion, so he does used to, tell some homeopathic medications to his patients. Yeah, so, but I don't know why it has gone down in UK. Maybe we need some better homeopaths like you.
Oh,
yeah.
Thank you. Yeah, well, approximately there are 400 NHS doctors trained in herbal medicine, homeopathy, and other natural therapies, and they see, the health benefits in the patients they treat. But as you said, I think a lot of it is that homeopathy has been, well, even the Wikipedia definition of it is described as quackery and that placebo effect. So because you can't patent homeopathic remedies, that's the thing. There's not really a lot of money to be made out of it, I think. So again, that's another argument and another discussion, isn't it? So
no, but
it's just the tip of the iceberg today, isn't it?
Yeah, but no, that was quite useful because we all know about homeopath, but we don't know much about it, and you like think 100 times before you go for a homeopathic medication, and you need to find a right homeopath as well who can prescribe you. So it's all, yeah. But now that we know that you're, with us, yeah, if anybody needs any help, at least as you said, they can have first online consultation or in person free, and then take it from there. Yeah.
That's right. That initial discussion,
Yeah.
isn't it, to see if it's for you and maybe
Yeah.
what could be done, isn't it? So, well, thank you so much for inviting me.
Yeah.
As I said, I was a little bit nervous about coming on, and I was terrified the dog was going to go and start barking, which she did, but
Well,
it
she
was
behaved.
okay.
We couldn't hear her much anyway. So,
Yeah.
but yeah, thank you very much for sharing all that knowledge and yeah, your own personal approach. It's great. Definitely clearer understanding of homeopathy and its history and what it's all about, and how you can help us if we have a need, I suppose. And you've mentioned obviously some of the conditions that you can help with. But generally, anything else regarding holistic health, you're there to support people, and I know how loving and caring you are, and always give your utmost to anybody in any situation. So thank you very much, Jerry. We really appreciate you having being part of this live and leading it for us on this topic rather. And we thank you. Thank you from me, and thank you from the whole team at Thriving Communities. And thank you also for the work you're doing for us as a volunteer. It's very, very valued. Thank you. And thank you all to all our listeners as well for taking the time out of your busy day just to listen in and support us in this series. And hopefully thank you. And hopefully you'll join us on the next one. We have yet to confirm that the talk, because we had to move the speaker around again because she's not able to do the talk, but we will confirm soon what that talk will be about. So that'll be in 2 weeks' time, the same time on a Monday. Thanks very much, and see you.
Thank you.
Thank you all.
Bye bye.
Thank you. Lovely to meet you, everyone.
Bye.
Thank you.
Bye.
Bye-bye.